Hi, I'm Dr. Rahman, and I like to talk about something that's very private and personal. As an OBGYN, I see women on a regular basis, and I have noticed that the majority of the women that I see have either shaved or waxed to remove their pubic hair. And the question is, why? You know, and if we have it, does pubic hair serve a purpose? And I would suggest to you that yes, it does have a purpose. And that purpose is to serve as a barrier against unwanted bad bacteria. And so when we remove our pubic hair, is that a good practice? I mean, are we helping ourselves, or are we hurting ourselves? Or yet another question, are we just following another artificial standard of beauty, that women are supposed to do this in order to be perceived as beautiful down there or desirable? And I would suggest to you that women have been exposed to artificial barriers, artificial constructs of what is beautiful for thousands and thousands and thousands of years. For instance, what comes to mind is that in China, loving mothers would break and bind the feet of their female daughters in order for them to have petite feet. Because why? It was a standard of beauty. It made her more desirable. It made her more likely to find a husband. Not too long ago, women were subjecting themselves to corsets to have these unrealistic, tiny waists. And why? Because it was a standard of beauty. A woman with a teeny tiny waist was considered beautiful, irrespective of what harm it might be doing to her body. And so, just in case you're wondering, that we would never do something like that today, I'm suggesting that maybe in fact that may be why the majority of women subject themselves routinely to waxing and shaving, and some of the negative consequences that can occur as a result of that. They can develop superficial folliculitis or infections of the hair glands as a result of shaving and manipulating down there. I am saying that we have standards of beauty today, and do we find ourselves falling prey to these standards of beauty, such as BBLs? BBLs are now considered desirable. There's some women that are born with BBLs, but now it's become that everybody wants to have it because it's a standard of beauty. Women in the past have had breast augmentations because standard of beauty. And so you have to wonder, why do we fall prey? Are we so concerned about how others perceive us that we are not able to appreciate our own beauty as we have it? Are we so obsessed with meeting some standard, some artificial, arbitrary standard, that we potentially are willing to injure ourselves and subject ourselves to
not only BBLs, but butt injections, like
butt injections.
yeah, like
butt
I think
injections.
like the illegal.
And the question becomes, these standards of beauty don't stay forever. So when it's no longer popular, when it's no longer considered a standard of beauty, what happens to the woman that spent thousands of dollars, that's traveled out of the country for surgery? What happens when the standard of beauty changes? And I'm saying to you, the standard of beauty always changes. That's the one thing we can count on. It changes. And better to be able to enjoy and celebrate who you are, the way you look, the way you were born, versus subjecting yourself to an artificial standard of beauty. Now, that's not to say that you should never consider surgery, because some women have this surgery as a way to feel better about themselves. But I am suggesting that maybe the problem is not the physicality or the physical thing that you're looking at, but maybe it has to do with how you perceive yourself.